child is suffering from psychological disorders, they tend not to be limited to one specific section of population growth. Both urban and rural children suffer psychological issues which need to be handled by a professional. The idea of a rural psychologist is one that often frightens people, both with a negative stigma and with the possibility of having to accommodate a travel expense, which could become astronomical in cost. No parent would like their child to suffer from any malady, whether it be physical or psychological, and as such, telemedicine has found a solution to this concern. This provides the child which needs treatment with a much easier accessibility to receiving the helpful treatment they so desperately need. This is no better exemplified than in a study in biobehavior by the University of Iowa Hospital and Clinics. They felt that a child could receive treatment via telemedicine and slowly began to show signs of improvement. They focused on 2 patients in this certain case study with a 4-year prognosis and followed them intently through those years. While undergoing the studies, the researchers made notice of the progression of the children following their treatment and noticed an improvement that showed psychological treatment and therapy could be performed via telemedicine to provide relief. This type of improvement is only the start of a new era in medical communication, in which daily visits or doctor's appointments could become a thing of the past. Psychology is also a field in which the niche of telemedicine can seem to show the greatest improvement, I feel, amongst all other forms of telemedicine. The ability to allow the patient in the comfort of their own home access to a therapist could show many wonders in the areas of mental health relief. The stigma which is held over mental illness could be mitigated by simple access to a computer and a program which the patient and therapist could feel yields the best possible result. The immediacy of communication could also be far more reaching now that a great deal of Western civilization is carrying around smartphones, which could be adapted to assist in the therapy sessions. If a patient were ever to suffer a malady, it could just be as simple as dialing in on a phone or opening up an app to connect to a trained medical professional, which could assist them through a trying time instead of having them to be forced burden upon the emergency care centers or hospitals. The benefit of having telemedical communication does not stop with just treating the mental illness of children. Unfortunately, it is common for caregivers to be forced into situations where they are choosing between the health for their child and the earning wages for the day. This burden is something which would weigh heavy on anyone, but especially those who are paid hourly and depend heavily on the income provided for their family. This is often the case with mental illness, in which they affect the surrounding people negatively, just as much as it plagues the patient. The burden is then felt both by the patient and the caregiver, none of which makes this process any easier or less painful. A study performed by the Health E-Access Telemedicine Network of Rochester, New York found that 56% of the caretakers would miss a day of work or longer with a child suffering from an illness. This statistic includes both physical and mental illnesses, which shows how often caregivers are forced to make this decision. With access to telemedical advances, though, it was shown to have a drastic improvement in the handling and well-being of the child, and this is providing the caretaker with either a way to control the symptoms or at least mitigate them enough to allow their schedule to not be devastated. When participants were asked about how telemedicine was assisting them in their daily lives, 84.6% showed nothing but praise for the system, and those 15.4% dissenting of the program. A majority felt a concern was with the direct communication and with them feeling it was unreliable. This, of course, is to be expected when it comes to using something that is new technology, and it will gradually lessen over time the more caretakers and patients become used to this program. Another success attributed to telemedical advances in the area of psychology was performed by Catherine Steger and her colleagues in the field of childhood obesity. She administered pamphlets throughout rural Pennsylvania which contained contact information with qualified medical professionals. These medical professionals could assist in any concern participants would need regarding food consumption and other possible avenues of reducing childhood obesity. This study did focus a great deal on physical concerns, such as exercise and what was consumed by the family, but they also focused on psychological avenues such as eating dinner with the family. They also noticed that with developing a normal eating cycle and increasing positive mealtime experiences, the parents were able to reduce the amount of behavioral issues during mealtime. This information is quite valuable because in the current predicament we find ourselves, obesity is on the rise, and if left untreated, the medical costs could raise far beyond what is expected. This simple idea of having access to a telemedical professional would be able to decrease the burden of future medical care areas and allow them to be far better prepared for any more future necessary procedures. This idea of allowing technology to allow easy communication between doctor and patient then brings in the unfortunate dilemma of if the patient themselves feels that the procedure is actually working. The idea of telemedicine provides assistance with the patients themselves and allows them to be the primary person in control to determine if the psychologist they are working with is the best fit for them. The study performed by Anne-Marie Gorelish and her colleagues at University of Stanford, Manchester focused greatly on the idea idea of acceptance and the use of telemedical innovation. While performing the experiment, she uses 65 adolescents to determine if telemedical communication would be useful and accommodating enough for allowed repeated use. What she found was that the participants felt a great appreciation for technology, some going as far to say it was at least as good as going in person. The patient also felt empowered by the idea of allowing them to terminate or end any session they felt was not yielding the right result. This shift of power brought about a sense of control to the patient, which was normally not given when a session is face-to-face. This also provided a great help to many clinicians which experienced hesitancy towards replacing the therapy sessions. But with results, it proved to them that it was a positive correlation between telemedicine and treatment of patients. Technology has also advanced enough for us to allow something which before was just a fictional idea of seeing the other person on the other side of the phone. Video conferencing has become common now with the current technologies and innovations, and this brings a great advancement in mental health diagnosis and treatment. While video conferencing decreases the costs and stresses upon the patient, it also provides the psychologist a way to look at the patient in which they feel the calmest. This can greatly assist in diagnosing any problem by allowing the patient to feel more in tune with their surroundings. Children are especially in tune with this, since familiarity tends to bring about a sense of calm, and this allows them the opportunity to openly communicate without fear of being in an unknown environment. While this is a great thing to be sure, the ability to keep communication with the patient is far more valuable towards reaching the end goal of controlling or even curing their mental illness. The act of repetition is what is required in mental health treatment, and with video conferencing that provides the avenue, while removing a great deal of limitations from the patient. In our current population, it has become more common to see children diagnosed with developmental disabilities, but even while we notice more being diagnosed, a great deal of them still remain undetected. One of the more prevalent disabilities in the children is the autism spectrum disorder, or just more commonly known as autism by most of the population. This developmental disorder has a concerning trend, which is that medical professionals can only test for it and are limited by both space and time allotted to each patient. These professionals are often called to many areas at once and are forced to make decisions on where they will be best suited to travel to provide the most results, and this is a hugely limiting parameter for them to have to deal with. One prime example of this is in Iowa, which has less than 25 certified behavioral analysts for the entire state. This then lends itself well with the idea of allowing telemedicine to provide the psychologist an easier time to diagnose the patient, and this would be by cutting travel out of the equation. This would then free up time for psychologists to see much more patients and allow parents to be better prepared in raising their child. The idea of limiting our response to mental illness or developmental disability seems nothing short of criminal. We are knowingly holding back the advancement and treatment of children when we deny access to telemedical communication, and that is something no one should be subjected to, especially our younger generation. We were always told to make the future better than when we arrived, and by us limiting this impressive ability, we are doing no such thing for the future generation. Instead of us trying to fight technology, we should embrace it and allow it to do what we've always hoped, which is a better future for everyone.